Military docs. What are some interesting differences between military and civilian medicine? The following responses will be from different people. Army surgeons in early days of Iraq got quoted in NYT saying major diff between military and civilian patients is, the troops are in perfect health up until the moment they are injured in combat. It makes for easy, almost textbook perfect surgeries. Nobody has other chronic problems that would complicate matters. Other thing they mentioned, there was some mild medical equipment. It was flown in 24 or 36 hours later, no questions asked. They'd never seen operating rooms with so much redundant equipment, all of it state-of-the-art. No need to delay for a few hours a medical procedure until a facility or piece of equipment was available. Medics learn a lot of stuff on the job that they would never be allowed to do on civilian streets. Suturing, injections, etc. I'm Vietnam era and rotated through several hospitals in Germany. Doctors were happy to teach. Oh, and I helped with several deliveries. My EMT instructor during phase 1 of school. Remember everything we tell you because this will be important. My medic instructor during phase 2 of school. Forget everything they taught you because it won't apply to you as a medic. My co-workers when I applied for EMT firefighter. Forget everything they taught you in medic school because it won't apply to you as an EMT me. Well-ish. I was told to forget everything, and now I know nothing. Traditionally, military dentists can work voodoo magic with amalgam for dental work. In the civilian world, we just use resin composite, the tooth-colored stuff, with a bonding agent. The reason I say voodoo is that amalgam silver fillings don't actually bond to anything. It's held in with physical friction and structure. You have to drill the tooth a certain way to make sure it doesn't fall out. And I've seen some work on veterans that are over 20 years old, and I have no idea how they made it stay in place in the first place. The patient population tends to be much younger and healthier. The flip side is that they tend to be much more reckless, so self-destructive behavior like smoking and engaging in risk-taking activities is rampant. There also tend to be either massive overutilizers or underutilizers of healthcare. The overutilizers go in for minor aches and pains because there's no copay and it will get them out of work or certain aspects of their duties they find undesirable. The underutilizers are the young men and women who try and tough things out or fear consequences if they seek medical care, so they tend to avoid docs. Another huge aspect of military medicine is the career implications you can impose on someone as a doctor. In civilian practice, there's little issue of giving someone a diagnosis, however. Putting certain diagnoses in a service member's record can be a career killer. Imagine being in 17 years, 3 years from retirement, then some doc puts fibromyalgia in your chart, and now all of a sudden you're being looked at for medical separation.